Welcome to another brand new episode of the Tech Your Business podcast, where we show you different ways you can use tech to stay ahead of your competition, tech to make doing business easier, much better, and also tech to make your business profitable and to grow your business. So today on the Tech Your Business podcast, we'll be talking healthcare. We're talking tech forward healthcare. So how someone is using tech to make big changes in the healthcare industry. And that someone today is Whitney. So welcome to the show, Whitney.
Thank you so much, Peter. It's great to be here.
Yes, thank you. So tell us about I decided to save that for you. So just tell us about what you're doing with tech in the healthcare industry and also about yourself, how you got here.
Sure. Um, so I guess I'll start a little bit about myself. So I am a registered dietitian by training and have had a fairly traditional path in terms of clinical care in healthcare. So I started out in a community hospital setting, treating patients, and then I moved over to a multidisciplinary medical practice and helped get nutrition services set up for them and delivered outpatient counseling. um, and that was kind of what I thought I was going to be doing for the next decade or two, and it turns out I did not like it very much. So I kind of continued to grow in clinical leadership, went and worked for major health systems in New York City, and was managing a team of dietitians and worked in operations leadership, and simultaneously went back to school for my MBA. Um, and while I was doing all that, I had met some business partners and launched a digital healthcare company that was aimed at using digital health tools to be able to support cancer patients through their journey. Flash forward 6, 7 years, we had grown that to about 6,000 patients. And one of my other co-founders, he actually had this other business, which I'm now, working with and supporting, called Archer Review. And with Archer, we use education technology, so use tech to be able to deliver really seamless medical and nursing test preparation, and board review curriculum uh, type resources for medical and nursing students. So, my career has certainly taken a few twists and turns along the way. If you had asked me, 15 or 20 years ago that this is what I'd be doing, I never would have believed you. But there's so much opportunity to leverage technology to be able to do great things at scale for a wider swath of people and really increase accessibility, um, in my present use case to education, in my previous use case to supportive cancer services. So, I definitely am kind of a big believer in the opportunity that technology presents to us, and fortunate enough to have had that clinical experience to really understand the nuances of what's challenging in healthcare and where there's opportunity.
Okay, so I think before we get to your current venture,
Yeah.
I'm interested in learning more about your previous one where you talked about supporting cancer patients through digital healthcare. So how did that work?
Yeah. So we built out a community, kind of first, and embedded tools into that community where people could, for example, like journal every day or have a gratitude practice around their cancer journey or reflect. We had some more clinically facing tools for example, like a clinical trials matching tool that was, you know, took inputs from the patient's profile and sort of better matched them up with clinical trials that are going on in the space. Um, and kind of, I always like to say it was like the etc. of healthcare. It was all of the stuff that doesn't happen well in office. It was not replacing a medical treatment, but it was like the social, emotional support and information that helped patients navigate their journey, or at least just feel less alone while asking all of those questions.
Amazing, and I can see how that would really help because a lot of times when you have a diagnosis like that, a lot of times you just sit and catastrophize and think of the worst. It's difficult to be positive in that sort
Yeah,
of situation.
yeah, no, certainly. I mean, it's an awful road, but what we noticed is that when people kind of broke it down to day by day and week by week and like had a little bit of self-reflection embedded into how they were thinking about their journey, they actually had a lot more good days than bad days. And it's sometimes when you're in the thick of it, it's like hard to kind of recognize that.
Yeah. Okay. So now for your current venture, where you have the test and co, what are the best reviews you've gotten from people? What are the best changes you've seen it makes for people?
Yeah, so we really got into the nursing test prep market from the ethos of, supporting accessibility. We noticed a lot of the companies in the market hadn't really innovated their products in a long time, and they were kind of charging students an arm and a leg. And here we are facing tremendous healthcare shortages. And, people are just trying to pick themselves up and have a livelihood and be able to support their families. And so to charge them a ton of money right up front before they're even in a healthcare career, just it didn't seem to line up with, where we felt the market should be. Um, and so we introduced a test preparation product. And I think because our instructors are just very real, a lot of them are, continue to practice and are able to give real life examples. Um, and so there was a connection that started to happen between the students and the instructors. And so I think we were very fortunate to kind of find this little toehold in the space and be able to ride that wave. And we have a product. It's an education platform that you can access from anywhere. So I think that there's really, we see students from all over the country and all over the world using our materials. And I mean, the best testimonials are the ones that are like, I've tried to pass these boards 3 times and I wasn't getting anywhere. And now I took your exam review and I passed. And like, I can now start a career I'm really energized about. I can give back. I can help my family. So, I mean, those are the really, really meaningful ones. But yeah, it's been a lot of fun in that whole space. And I think part of the reason that we've found this success is because we went into it for the right reasons.
So when you say the right reasons, what would you say those are?
I'm sorry?
And so when you say the right reasons, what would you say the right reasons are?
Oh, the right reasons being to genuinely support the students along the path and give them, to lower the barrier to entry for healthcare. So making those preparation materials much more affordable and accessible, and being able to help. excuse me, being able to help people get into a career that they're excited about. Um, that there's nothing more rewarding.
Amazing. That's really amazing. And I think listening to good feedback from a product you've built, I know how that feels. It encourages you to do more and
Yeah,
build
yeah,
more.
yeah. Yeah,
Yeah.
certainly. I know.
So,
Yeah, your first customers are your best asset in terms of refining a product and making sure that it's really working for them.
yeah. Okay. So, what has been the most difficult thing about getting this product right to the right end users, either technically or otherwise?
Yeah, that's a good question. I mean, it's, you know, we've very much followed like a bootstrapping model. And so I think just like any early company, making the call, especially early on, about resource allocation and what things can we build in what timelines that support, this customer feedback loop that we're getting from people and the feedback that we're getting from the students. And then kind of combining that with like, where do we innovate? Where do we go ahead and try to um, create new products and things like that. So, like some of those typical early questions have been tricky. And for example, our nursing offerings are much more robust and well-rounded than our medical offerings because it's a little higher bar in terms of cost to produce those exams and to make sure that we're bringing in the right expertise to offer a product there. And so along the way, we had to lean into one strategy over the other to be able to get to where we are now. And it doesn't mean we won't be expanding our medical offerings now that we have a really strong, you know, base business. But that was the call that was made in order to expand and grow and be able to stay focused and bring a product to market that is really genuinely loved by the healthcare community.
Okay, because I asked that question. You mentioned we were bootstrapped, and I like asking this question to follow that up
Yeah.
because I've heard a mix of both sides. So why did you go with bootstrapping as against looking for funding? Because there are two schools of thought. So I'd like to know your own reasoning.
Yeah. Yeah, absolutely. Um, I mean, I guess so. Our founder and CEO is a medical oncologist, and so he continued to work throughout like the early building of this business. And so I think because he kind of had those parallel lives and was not dependent upon going all in on something, um, it kind of helped that bootstrapping mentality. It kind of aligned, right? Because he was doing it evenings and weekends, and not taking a penny from the business, but putting anything that it generated back in. And so, yeah, I mean, there's certainly, you know, there's not a right or wrong answer there. I think that there's like many situations where it's really helpful to go ahead and raise capital. It's just that the nature of how this business started to unfold is that some of those early customers could go ahead and support we've managed the business very carefully and cautiously, and so having that approach to financial management kind of allowed us to get away with bootstrapping the business, if that makes sense. But I agree with you that there's many use cases and there's no right or wrong. It just so happens that the timing of when, you know, when the sales started to explode versus like some of the earlier money that went into building it, you know, started to like be able to perform on its own, like we were able to get away with not raising huge capital, or seeking any kind of debt financing.
Yeah. And I think like for me, I actually prefer bootstrapping because I've realized a lot of times when you start a business, it doesn't really go according to plan, and a lot of times people take capital and go all out on that initial plan. That's not the right way it should have gone. You might end up just making a big mistake. But when you bootstrap, like you said, your founder had was working too, so he didn't really have to depend or stress the business. So that way,
Yeah,
he was
no,
able to do
certainly.
more.
Yeah, no, I completely agree with you. I think um, there's a lot of advantages to it. I think it's often a harder road, but there's a lot of advantages to it in terms of not burdening the business with like outside investors or outside capital or notes. So,
We just finished a little fight with technology. It won't show, but
what's a tech podcast without a little hiccup?
okay. So let's continue. You mentioned earlier that you've helped start 5 businesses over your career after being a dietitian, trained as a dietitian, and everything. So, what's the most important lesson you've learned about a business or a venture being successful?
I think the most important thing that I've learned is that like the team matters more than the idea. I think before, kind of doing anything or getting into this space, like I was very intimidated by by the notion that you had to have like this perfect idea um, for launching a company, or this like very perfect innovation that you're getting into the market. And now, having been through a few companies and a few, interesting, like digging into the space a little bit more and having a ton of conversations with various entrepreneurs and investors and etc. The idea is not so important, but who you're executing it with, your ability to really work together, all row in the same direction, be flexible to pivot and to accept feedback, and to sort of, be looking at how markets are evolving and changing, and adapting said business or idea to that, is actually way more powerful than like a singular idea itself. So, yeah,
Yeah,
it's the
and
whole,
I think
yeah, investors invest in teams and not products, right? And it's really kind of true.
it's true because, and I think that ties in with what I mentioned earlier about business plans not going according to plan. Because
Yeah,
if ideas were the main thing, they all would have gone according to plan.
right, right. Yeah, that's so true. I know. Adaptability is key.
True. So now, still talking about the team, how do you maintain a strong company culture, especially with something like you have the technical folk there and you have the non-technical folk there, and both of them communicate and think a lot differently a lot of the time. So how do you maintain a strong company culture in that sort of environment?
Yeah, yeah. I mean, I think that the key is trusting the people that you're working with and celebrating every little win, right? Especially when you're kind of in that like startup culture. Um, a win could be getting something into market. A win could be your first 10 customers. A win could be a meaningful testimonial from somebody that's used the product. And so, one thing that I think that we've built a really nice internal culture around is just celebrating those things, and and trusting. I say trust because when people feel empowered by their work environment, then they kind of start to do their best work and give it their full authentic selves. And we're, in an area, education, where like authenticity, that can be sniffed out like from a mile away, right? If somebody's trying to just sell you something for the sake of getting you to make a purchase versus if somebody wants to support your path as a student or as an early clinician, like that gets felt by the end user. So I think that giving our own team a little bit of like flexibility and trust to be themselves and to deliver what they um, feel is important, in terms of content to the students and be able to have some flexibility with how they're supporting their students. It really has led to a very nice culture across the team. And then, your customer feels that.
Okay. So now, at Archer Review, do you use, we know everybody has been talking AI and co in the past few months or probably years. How do you use AI at Archer Review?
Yeah. So we're actually, it's funny you say that. I would say we're entering it cautiously. So we certainly use AI, LLM, like large language model type resources for, some of our early copy or things like vetting ideas or like spitting back out iterations of questions. But it's actually not. It's. I will say this: we've not used embedded any generative AI into the learning platform. We have some roadmap in terms of doing so and using our own proprietary content to train a self-contained model. But we're not kind of currently leveraging AI in terms of the products that we sell to the market. We are using machine learning, so some people kind of umbrella that under the camp of AI. Some don't, but we have used machine learning to help really build out the predictability and reliability of our exam results, especially over time, right? So it takes a few hundred inputs to start to get really good quality data. But now that we've, helped more than 500,000 students, all of that content and the um, how the learning management software kind of like spits analytics back out to the students, it's gotten really fine tuned, and we're able to say like, if you just focus on like this narrow area, this is really where you're struggling, this is really where you're missing concepts, and if you can nail this down, you will be able to improve your board exam scores to the point of passing. And then we're able to sort of feed them that content exactly and say, you can find remediation in these 3 videos that tackle like all of the concepts that you're struggling with. So from a machine learning standpoint, definitely, very much deployed in our system and in how the analytics works on the back end and spits information back out to students. But yeah, AI, we're still being a little cautious about. We've been doing some testing and we would only use our own proprietary assets, because we don't want to start feeding that into somebody else's company or product.
That's an interesting approach. So now, for other tech you use in the business, probably apps, software, web, and desktop software. What are some interesting tech you use in running the business?
Let's see, our tech stack, the our website and and platform is built on AWS. So we use, Amazon for that. We leverage Stripe for payment systems. Um, we use Monday.com for our like project management and kind of team organization. We use Slack for team communication, um, and a little teeny bit of the Google suite, like Google Calendar, Zoom integrations, Google email for, the company. Um, yeah, so, oh, what's an interesting one is we do use Tableau to input like and dashboard tons of data around the business and customer feedback cycles and product planning and things like that. So that's always a fun one. Get to kind of see in real time some of the information that's getting kind of spit back through. But yeah, I mean, I think you know these companies they're doing well for a reason. They're very refined tools. It's very easy to get a team on board to these tools. We use Canva for a lot of our like design and materials, graphic design, materials management. So I kind of assume that these are a lot of the same tech stack that many companies are using nowadays, but maybe we're a little bit of an outlier.
I know Tableau is not used by everyone, so
Yeah, that's a unique one. That's fair. Yeah. That's fair. Yeah.
so talking about Tableau, how important is the data in making decisions and cohort actual review?
It's definitely important. I mean, it's funny. I think that we have a pretty good finger to the pulse in terms of engaging with our audience. That sometimes you start getting like these little tiny threads of feedback that are subjective. Um, and you start to form an idea, but you're not really sure. And then the data starts to sort of tell you that. Um, you know, over the course of the next several weeks or months. So I think one does not displace the other, right? Like you can get much more nuanced feedback from your customer base, and from, you know, how people view your brand, um, in very subjective ways, but we do always try to kind of like have some sort of data narrative running through our decision making. And sometimes that's in the form of trying to figure out what KPIs are most meaningful to be tracking, and sometimes that comes in the form of just looking at a whole bunch of information coming in and saying, all right, well, what is this really trying to tell us? Um, So, sometimes it's more clear cut than other times, but we definitely try to use data, for example, like to see in terms of a sales funnel from demo to conversion, like seeing where people are engaging with the demo, where is their fallout, from them utilizing, um, and then trying to enhance the experience to continue to drive them towards our product.
Okay. So, can you share an example of a time when using technology at actual review helped with your efficiency, helped with your productivity, or made a really big difference from maybe one of those tech tools you mentioned earlier?
Sure. I mean, I think that like when we first kind of got people onto each of those various resources, we started to feel the benefit pretty quickly. So, for example, I would say that when we put in place a much more formal product planning and feedback cycle process, in Monday that was repeatable across products and that allowed us to integrate other tools such as Canva, right in the same dashboard, keep as much of the product development, you know, rooted in one place as possible so that you kind of weren't trying to like dig through various files and like a Google Drive and a this and a that and emails too. There sort of became this single source of truth for where a project or product was living and where along the process that it needed to happen. um, that was absolutely instrumental in us launching a we launched a nursing school product this year, so 20 courses that could be companions to nursing students throughout their journey. Very affordable and accessible, but really helping to make sure that they have have mastered the content that is necessary to be a nurse and to succeed in nursing. And I mean, that was a massive project lift, and to be able to organize everything really efficiently by, integrating things like Canva and we used Descript for like editing all of our video content. So like every little teeny piece of supporting technology that went into that product could kind of be visualized in one place, which was helpful. We've also used a company called Brandfolder to begin to manage all of our digital assets, so all of our medical illustrations and things like that. So all of these pieces kind of came together very robustly, and all of these like little tiny decisions that we were making throughout the year about which resources we would use to support a particular area, like kind of all came together into one place, and that was really nice to see.
Great. So now, if you could go back a couple of years to
Sure.
your younger self
Yeah.
and give your younger self one piece of advice about team building, about technology, or maybe about business, what would that piece of advice be?
Oh boy, you're putting me on the spot here.
I actually don't know how to answer that question.
Yeah, I mean, it's such a good one because like there's so many different ways you could take it. You could take it like more practical. You could take it like more ethereal. Um, you know, in terms of like in terms of just like general career advice and business advice, I think I would tell myself like, you know, take some risks and, where you can measure twice, cut once, but at the same time, like you will make mistakes and it will be totally fine. I have to say, I've made plenty of mistakes along my journey, and like sometimes those mistakes brought more learnings than if like it had just gone right to begin with. And I'm a big believer that like, there's like maybe one little nugget that you don't even recognize in the present, but then like flash forward 3 years, you're kind of faced with something similar again, and you now have that layer of information for better decision making. Um, Growing up, my dad always used to say, good decisions, bad decisions, at least you're making decisions. And I thought that was like very ridiculous advice. But now that I'm an adult, I like can see the benefit and understand like the thinking there. Yeah, so I think like overall, I would say kind of like trust your gut, trust the journey, like get out there, start making decisions. Um, but yeah, I know that's not like the most tangible, practical advice in terms of business.
I think that works too because making decisions is very important, especially in business. Because if you sit on the fence all the time, you won't. They say you can't. If you're not moving forward, you're moving backwards. So It's actually really
Yeah.
practice. It's good advice for anyone who tends to be indecisive.
Yeah.
Yes. So for listeners who want to continue this conversation, we've been on for almost 40 minutes, if I'm right. They want to continue this conversation, they want to connect with you, they want to learn more about Archer Review, or maybe they want to use Archer Review, learn more, use the product, or learn more about the
Yeah.
future of Archer Review. What's the best way to reach you, reach Archer Review?
Yeah. Join us, reach out. I mean, you could check out our website at archerreview.com, ARCHERREVIEW.com. We are on Instagram as Archer Nursing. We're on, TikTok and Facebook as well. We have a few Facebook groups that are very focused about which exam support area. So you'd probably have to kind of look us up by looking up like Archer Review, NCLEX, Archer Review, nurse practitioner, etc. But yeah, I mean, I'm always amenable to connecting with people. So if you're listening to this and you want to find me on LinkedIn, my name is Whitney Isola. So WHITNEY ISOLA. Please feel free to give a shout. I really am such a big believer in supporting each other in this space. And like, if answering one question for somebody helps them in making a decision or getting to a resource faster or things like that, like I'm always happy to do it. It's no big deal. So please don't be shy to reach out.
So that's amazing. You heard the listeners. Don't be shy to reach out to Whitney, and the links to actual review and everything will be on the show notes and on the screen and in the show notes once this episode goes live. So thank you so much, Whitney, for coming on. Thank you so much for sharing with us. Thank you so much for fighting technology with me today.
Yeah, thank you so much for having me. This was so delightful.
Thank you. And for the listeners, did you get any value from this episode? In learning about technology in healthcare, learning about building and everything. If you did, please share it with anyone who you know would be interested in this same topic. And if you want to be the first person to know when we post more helpful content like this for your business, don't forget to follow, like, share, subscribe wherever you see us, wherever you hear us on. So we have over 100 episodes. We bring out one episode a week. That means before a new episode is out, you have a lot of episodes to listen to. So till next week, listen to them, learn a lot, and don't forget to keep taking your business. Bye for now.